I'm Aparna Lakkaraju. I'm an associate professor in the Department of Ophthalmology at the University of California, San Francisco. My lab works on identifying mechanisms at a cellular level that drive pathology in blinding diseases like age-related macular degeneration. We use a lot of new technology, such as live imaging, to look into the living retina to see exactly what's going on in the healthy versus diseased tissue. So we can pinpoint exactly where the dysfunction is. And using these kinds of techniques, what we've seen is that as the retinal pigment epithelium, or the RPE, which is the first site of damage in macular degeneration, as it ages, it accumulates a lot of debris, both within and outside of it. And this debris then goes on to interfere with many important functions in the retinal pigment epithelium. And it can cause the accumulation of even further debris, lead to inflammation, and also lead to potentially defects in metabolism. And using this information, we found out that we could use certain drugs that are already in the clinic that have been used for many different indications like depression, allergies, osteoporosis. We can use these drugs to reverse some of these phenotypes, some of these pathologies, both in our tissue culture models and in the mouse model of macular degeneration. So right now we are trying to do further testing on these drugs to find out which are the most important, the most effective in treating the mouse models of disease. And we just got a patent on it, so we are trying to work with pharmaceutical companies to take it into the next level.
What kind of drugs are you using in your research?
Drugs that people have been taking for decades for depression and anxiety and allergies. And they've been around, so they've got established safety profiles, established efficacy profiles. And we see great results in our mouse models. So we're waiting to take it to patients.
Is there a commonality in the drugs that you're looking at?
They all, as an off-target effect, they inhibit an enzyme called acid sphingomyelinase, which increases the level of fatty lipid called ceramide in the cell. Now, ceramides are very important, a second messenger. So it interacts with a lot of different pathways in the cell, like metabolism, inflammation, clearance of debris. So it controls a lot of things. So what we found is that more ceramide messes up all these pathways. So then these drugs prevent or lower the levels of ceramide, and that's how they help the mouse models of disease.
What are your next steps in this research?
So in our research, from a biology point of view, we're more interested in looking at digging further into this pathology, seeing how at different stages and ages, what are the changes that happen, which is a big question that came out of this meeting is when should we intervene, right? First of all, what drug do you want to use and at what point do you want to intervene? So we want to look at which stage, based on our studies, is the best. What's the tipping point? So as we age, what is it that tips us off onto the disease? That's where we want to intervene. So that's what we're trying to point out.
How long before you're ready to move into the next phase of your research?
We are fairly confident that we have enough data to support a clinical trial. So we're trying to talk to people right now.
How would someone be able to get involved in this research?
Just look up my website at the ucsf.edu, or Google me or send me an email, and they can just get in touch with me. But patients, that's a bigger question because they need to go through the clinicians, and then we need to find a way to run a clinical trial.